Telemedicine is really like having a virtual doctor. You have a screen where you, the physician, can see the patient, but maybe more importantly, the patient can see you.
Telemedicine allows me that when I'm in a third world country or a place where there's not as many resources as we have here, that I can access or get access to a wide variety of fields of medicine or specialists that can help me right then and there.
For patients who are many hours from me, maybe in South Georgia in a rural community, they can have the same opportunity that patients who live nearby can have without having to leave either their doctor's office or their hospital facility.
Nearly every trip I've taken, I've had an occasion when I needed some extra help with a patient, or maybe a situation where I wasn't quite sure of what would be the best treatment. So in the past, I'd made phone calls back to people, cell phones, and to specialists, whether it's a high-risk pregnancy doctor or a cancer specialist, to help me out with the patient.
The resources to have an evaluation are not available in local communities. I like the fact that they were able to take the best of the equipment that was out there so you could use it. A camera that's so sensitive you could see the pores in the skin, you can look in the ear, a stethoscope that's very sensitive, you can do any type of exam you really needed to. An ultrasound can be done. You can view the ultrasound just like you were in the room with the patient.
And now with the advent of this new technology and internet spreading worldwide, then I can do more than just a phone call, but maybe add video to that in real-time consults where the doctor on the other end can see the patient and render advice.
While I was able to see the patient and I had seen the patient's heart before, we were able to have a third sight, another physician who was a pediatric cardiologist who was online as well, and he could see the scan, he could talk to the patient, so it was really a three-way conversation. So the patient got the benefit of 2 consults at one time.
Sometimes the vein of Galen can give you an RV that's thick and big, so that looks normal to me.
As the world population increases drastically, the number of healthcare providers is not keeping up at all. Telemedicine, I believe, is going to help provide more care and more access to medical care by this growing number of people, by fewer and fewer providers.
It's really an opportunity to bring a higher level to the community as opposed to having the patient go to the physician multiple hours from where they live.
We have to look beyond where we live and to carry that to other people, people who are really in need, people who have needs that we can't even imagine. And I think telemedicine is a tool that we can provide the best care possible.